And so I want to start with the first question. This comes up a lot, and it's because it's a confusing topic, I would say. And I would say there's a lot of information out there online. There's a lot of information coming from other providers and other practitioners that may conflict with what you're experiencing and also what I have seen in the literature and what I have seen clinically. And I want to explain it because it's, anytime you're looking at somebody's labs or somebody's current experience, what we're really talking about is your personal experience, right? When, let's say you're doing, which was what I'm getting ready to talk about, you're doing a high protein, low carb diet, you're working on your stress, you're working on your exercise, and you personally aren't seeing the effect of that. And I'm sure you go out and do what everybody does. You start reading online and you read a book and it says you need to eat more protein, you need to do more of that. Or maybe you're just starting your workouts and you're adding it and you're working out with a trainer 1 day a week and you do it and you're like, okay, those results aren't working. So one of the most important things I think about medicine 3.0, and I'm using somebody else's terminology that comes from Dr. Peter Attia, who I have a tremendous amount of respect for. And the reality is, medicine 3.0, the future of medicine and the future of nutrition, the future of research, is what we call N of one. And that means that we're looking at you as an individual. We can look at research and evidence within groups, and we can look at that and that's how research is done. You have to have a group of people to then come up with general guidelines. But those guidelines only go so far because you got to look at the person in front of you. We've got to look at what's really happening for you and what is really occurring. Because even if the evidence shows in a general group of people, this is how it works, if it's not working for you, it is not working for you. And the reason why your practitioners argue with you or don't is truly because they don't believe you're doing what you're doing. In a lot of cases, I've had so many providers over the years say, oh, your patients and clients are lying to you. That's not really what's happening. And I'm like, okay, I don't think people are paying money, good money, to come see providers, especially people that do stuff outside of Western medicine, outside of the conventional practice, and particularly show up with the intent to not do what they're paying for expertise to do. So I don't believe that to be true, and I know that's not true for my people and my patients. And so I want to go into specifically one aspect because this gets repeatedly asked of me